Gaucher disease is a rare genetic disorder that causes the buildup of glycolipids throughout the body, which are substances in the cell made up of sugar and fat. There are 3 known forms of Gaucher disease: type 1, 2, and 3, each caused by a mutation or change to the GBA gene. This gene instructs cells to produce an enzyme called beta-glucocerebrosidase, or GCase, which breaks down glycolipids in the lysosomes within the cells. Often referred to as the recycling center of cells, lysosomes break down waste materials, allowing the body to function properly. But when there are faulty GBA genes, cells don't make enough GCase enzyme. This causes waste to build up in organs of the body. All 3 types of the disease include symptoms of chronic fatigue, bone pain, and enlarged organs that may not function properly. People with types 2 and 3 also have complications that affect the brain, resulting in a loss of movement skills, low muscle tone, and difficulty eating. Age of onset varies widely from infancy or childhood into adulthood, depending on the type and severity of the disease. There are treatment options available that can help manage symptoms of Gaucher disease, such as enzyme replacement therapy and substrate reduction therapy. These require frequent, lifelong infusions or pills each day. These treatments do not address symptoms caused by the effect on the brain. However, gene therapy may offer a different way to fight Gaucher disease. Here to explain is Dr. Heather Lau.
Gene therapy aims to slow or stop progression of the disease through a one-time treatment that introduces a working GBA gene into cells to instruct them to produce the GCase enzyme, which breaks down the toxic buildup of waste in the lysosome.
This is done using an in vivo or ex vivo gene therapy approach. In vivo gene therapy is delivered directly into the body, meaning a vector carrying a working copy of the GBA gene is injected. Scientists know that viruses are good at getting into cells, so they have learned how to safely use this ability to get into cells as a vector or carrier to deliver the working gene. But don't worry, the viral genes are removed, so only therapeutic genes are delivered. An ex vivo gene therapy approach is done outside the body and has the same goal. A person's own hematopoietic stem cells, referred to as HSCs, are removed from the blood. HSCs are versatile cells that can develop into other types of cells. A viral vector is used to deliver the working GBA gene to the cells that were removed, and then these modified cells are returned to the body through an IV infusion. Prior to treatment, a process called conditioning will clear out space and prepare the patient's body to receive these new modified cells. Gene therapies for Gaucher disease are in clinical trials, which is a required part of the research process to determine if they are safe and effective. Being able to participate in a trial depends on criteria such as the type of Gaucher disease and the person's age and health. At this time, people who have received one type of gene therapy approach will not be able to receive the other approach, so careful consideration must be given to whether either clinical trial is right for an individual. For more information about gene therapy for Gaucher disease, visit patienteducation.asgct.org.